I'm Samuel Washington. I'm an assistant professor within the departments of urology and epidemiology and biostatistics here at UCSF. What excites me here at UCSF is the opportunity and potential, both on the research side as well as the clinical side. So it's kind of the opportunities and potential for research collaboration across departments. And on the clinical side, it's just our implementation of new technology, both in clinic and in the operating room. That's the most exciting. My goals for the future are focused primarily on disparities in access and treatment for patients with GU malignancies or cancers of the genitourinary tract. My goal would be to shift the conversation away from patient-level disparities to more healthcare institution and structural barriers to appropriate care. So I've been at UCSF for a long time, both as a medical student, resident, and fellow. And throughout the time, I think it's been successful in a sense for me in terms of learning, acquisition of new skills, understanding what I don't know, understanding how much expertise there is outside of our urology bubble, and successful in terms of collaborations both with people in the community as well as learning from people within UCSF who are interacting with people in the community and understanding ways to communicate some of the issues that we're seeing on the practitioner side to patients in a way that makes them want to come here and hopefully address some of the issues. I'm really part of a broader team, and that's not just the mentors that I've had throughout this process who raise the bar in terms of excellence, diversity, and expectations for me in terms of clinical work and research, but also it sets an example for what I should do as a mentor for my mentees, both fellows, residents, and medical students whom I'm now working with in bringing through this process and hoping to impart some nugget of knowledge that I've gained from the more senior people in my circle and hopefully impart that on them. So I think an aspect of my research is not unique broadly. And I think that UCSF, through the Watson Scholars Program and other initiatives, is very focused on reducing disparities, increasing diversity within our field and medicine as a whole. But I think that perspective is not well established within urology and how it's applied to diversity within our field and reducing disparities in the populations that we see. So I often see my research as bringing these well-established principles, initiatives, skills, concepts into urology in a way that has not been implemented before. So in that way, I'm trying to adapt something old for a new situation rather than trying to trailblaze. A lot of the work has been done through collaborative organizations or initiatives. So these are people who may be at other academic institutions, but as well as people in the community. And I feel for me, it's been a great learning opportunity to learn the different aspects and barriers when I step outside the bubble that is UCSF and really collaborate with other organizations that have partnerships like SF CAN or with Dr. Rhodes, the Office of Community Engagement in Umoja Health, or opportunities for me to learn, but also play a role in these larger initiatives and efforts that are going on around us. Being named a John Watson Faculty Scholar is an exciting opportunity, but I also consider it an investment placed upon me by the institution and everyone who selected me for this award. So I take it as an opportunity that I don't want to miss and an investment that I need to make good on in the long term.